Hi, Dr. Vicki Stein here, and welcome to the ABCs for Improving Mental Health with Lifestyle Choices. Today, we are going to be talking about functional medicine. A lot of people ask me about functional medicine and want to know what it is exactly. Functional medicine is a specific kind of medicine, a way of treating patients that looks for root causes. So I want to talk for a minute first about mental health, and then I'll talk more globally about just health in general. The DSM-4, if you can look at my screen, talks about it's really now it's the DSM-5. It's a book that has all of the descriptions of symptoms of all kinds of mental health issues like bipolar, depression, anxiety, ADHD, etc. And we use that book for coding for insurance purposes, but also to help us with diagnosing. So we look at a cluster of symptoms that somebody is presenting with, and we assign it a name and a symptom. It has symptoms and we assign it a name like depression or anxiety, and we treat accordingly. In this slide, I took this quote from Dr. Mark Hyman's book, The Ultramind Solution, and he and Dr. Thomas Insel, who was the director of the National Institute of Mental Health, were having dinner together, and what Dr. Insel stated was that the DSM-4, now 5, has 100% accuracy but 0% validity, and that it provides a perfect way to describe symptoms, but has nothing to tell us about the underlying biology of what causes them. And this is really the foundational piece for functional medicine, that when a patient comes to us or a client comes to us, or you go to a doctor or a therapist, you will report a cluster of symptoms. So for example, you might report, well, I'll give you a case study. I had a client who came to me many years ago. She was crying. It was her first session. She complained of not being able to get to work during the week. On the weekends, she stayed in bed all day. She didn't want to be with her husband. She was irritated with her children all the time. She was crying all the time. So if we look at that cluster of symptoms, it would appear to be obvious that she has depression. But what she and I decided to do was to treat her first by just improving her diet. And within 1 week's time, she was getting out of bed and feeling significantly better. And within a month's time, we were able to manage the other pieces of her life, and she stopped having to come to therapy. So sometimes it's a nutritional deficiency. Sometimes it is some sort of other biological issue, like for example, having a candida overgrowth, which is a yeast overgrowth that can cause symptoms that look like anxiety, but maybe could be treated in a different way than with psychotherapy. The medical model versus the whole client is another way of looking at the difference between conventional medicine and functional medicine. In the medical model, conventional allopathic medicine, you'll go to a GP, and the GP will listen to your symptoms again and will determine what specialist that you will be going to. So you might go to see a cardiologist, or you might go see a GI doc or a dermatologist. So we have all these different specialties that break the body up into different parts. But in truth, we are one whole part. We are mind, body, and spirit together, and we really need to be treating the entire person in a medical setting. So in functional medicine looks at the whole person, looks at what the root causes are that might be causing something that appears to be a mental health issue. So functional medicine is personalized, it's system oriented. It is a model that empowers the patient and the practitioner to work together. And it looks at the underlying causes. So we are not just treating symptoms, but we are treating the root cause of that symptom. It's not enough to say, you have a stomach ache, so we're gonna give you Pepto-Bismol so that your stomach doesn't hurt anymore. The question is, why does your stomach hurt? So my question with working with clients is, why are you feeling depressed? Why are you feeling anxious? It's not just about the fact that we're in a pandemic or that your kids are getting on your nerves. There may be some underlying causes, and we need to check those things first and see where you are before we start doing the psychotherapy and using those tools to treat whatever is going on in your life. The other piece of functional medicine is looking at what causes those chemical imbalances or what causes those biological issues. And what functional medicine says is N equals 1, which if you look at research, you'll always see that there are, that the research will say N equals, and it'll tell you how many subjects were in a particular study. So N equals whatever that number is. In functional medicine, N always equals 1, which means that you are unique as I am. And so one size does not fit all. So if I have depression and you have depression, our reasons are very different and our biological makeup is very different. And so I may not need medication, but maybe you do. Or I may need to have vitamin D and maybe you don't. We don't know, and it also makes sure that we have the assumption and the understanding that even if we both take the same medication or we both take vitamin D, that our reaction and response to that could be different. Whether I can absorb vitamin D or not, or whether you can or not, would have a different suggestion in terms of dosing. Like maybe you're fine with 5,000 IUs, but I need 10,000 IUs. So there are no true protocols. There are guidelines in terms of how to treat people, but it is always about testing, not guessing, and always about being curious and looking at the genetic makeup of the person, the external environment, and the internal environment. And by external environment, I mean exposure to toxins. Like, do you live near a golf course, or do you live near a manufacturing plant? Do you get clean water? Are you eating organic or non-organic? Are you able to afford to eat food, healthy food, or are you eating poor quality food? What are you exposed to? And then the internal environment is, as I mentioned before, how your body processes, how your body absorbs, whether you have some genetic issues that get in the way, genes that get turned on or turned off, that cause you to be more susceptible to mental illness or other systemic diseases. So I want to thank you today. Hopefully you have a better understanding of what functional medicine is, and I look forward to seeing you on the next call.